Hi, I'm Jane Green and welcome to JMG Changes Lives. This video is the first video in a series on obsessive compulsive disorder and anxiety disorder. Anxiety is the type of mental health disorder that specifically causes negative thinking. Unwanted thoughts are an extremely common symptom of anxiety disorders. Anxiety is the inability to control the thoughts that come into your head. For some people, anxiety can be caused by these thoughts, and especially if they are worrying thoughts or thoughts of past childhood or adult trauma. Unwanted thoughts are especially common with obsessive compulsive disorder, otherwise known as OCD. This is one type of anxiety disorder. However, OCD may also affect other anxiety disorders in different ways. So here are some examples of obsessive thoughts, how they affect your ability to cope with anxiety, and what you can do to stop them. While unwanted thoughts are most common with obsessive compulsive disorder, or OCD as it's called, every anxiety disorder can create unwanted thoughts in some way. From recurring fears to worst-case scenario thinking, unwanted thoughts are extremely common with any type of anxiety. The most important thing to realize about unwanted thoughts is that the more you try to fight them, the more common they become. That's what anxiety does. It prevents you from focusing on anything else other than the things that cause you anxiety. The best example of this is with OCD. Unwanted thoughts from OCD are generally called obsessions because of how difficult it is for you to stop having the thoughts once you've started. Now, some obsessive thoughts are harmless. However, some thoughts that are obsessive can be violent, fearful, or even of a sexual nature. Sometimes it's the same thought every time. Other times it can change depending on the situation you are in. Generally, the thought has something in common with previous thoughts. They are repetitive thoughts that you're having. For example, you may repeatedly think about a time as a child when you were fearful because of abuse and violence you heard and saw as a child. These thoughts appear repeatedly as pictures of the event you experienced. Other example of thoughts could be thinking about hurting someone or imagining a sexual act, often an aggressive or taboo one, or reoccurring worry about something simple like locking the door. Fear or thoughts about sinning, hell, or other religious imagery. This is only some of the thoughts you may have. It's also possible that the thoughts are about those who you know or strangers, for example. For these thoughts to be thought of as a problem, they would need to cause significant shame, anxiety, or distress. Very often, the thought itself may be fearful. For example, like the fear of getting dirty. This is why many people with OCD will repeatedly wash their hands. Your thoughts also may be negative thinking about how you see yourself. These often irrational thoughts about how you look can happen even if you look like a famous, gorgeous movie star. Because of your anxiety and or OCD, you may think you are not attractive, too fat, too thin, not pretty, not handsome enough, etc., etc. These patterns of repetitive thinking is why people get anxious and depressed, and after a while they start to have different types of eating disorders. Some may eat too much if they think they are too thin, whereas someone who is thin may think they are too fat, and so they starve themselves. Some people may even have violent thoughts about someone, or even violent sexual acts against strangers, friends, or even relatives. There are different degrees of unwanted thoughts, and all of them can be anxiety related. Even if those thoughts are violent or of sexual violence against someone you love or know, it does not mean you are actually wanting to do that. They are just repetitive, uncontrolled thoughts because of anxiety and or OCD. Unfortunately, once you start thinking the thought, it becomes extremely hard to stop repeatedly thinking about it. As you can imagine, if you are a person who would never dream of hurting someone you know or love, these thoughts of violence against others makes you even more anxious because you wonder why you are thinking like that. Yet, it is only because of your anxiety. No matter how hard you try to fight those thoughts away, they always seem to come back. That's why many people develop what we call compulsions. Compulsions are behaviours that you perform that help calm you down and reduce the stress that the thought creates for you. In other words, the compulsion of washing your hands repeatedly helps you feel less stressed about being dirty if your thought is making you feel like you're dirty. In other words, here are some other examples of compulsions in OCD. Walking in the door backwards, placing objects into perfect order on a shelf, tapping objects repeatedly, locking a door several times over, checking on the iron being left on over and over again, eating or not eating. Habits may make sense based on the unwanted thought, such as turning the stove on and off multiple times when you're worried about the stove, or they may seem completely random. For example, tapping a lamppost to avoid aggressive or unusual thoughts. Their development is often fairly complicated, and in some places it may occur from nothing more than chance.